I'm just starting in my role as Global Health Director, so I'm very, very excited to take on this new role. I've worked with Dr. Conkin in the past in the Division of Community Engagement. A few years ago was the Associate Director for Global Health, and then I moved to Halifax for a few years, worked at the hospital there, and then I came back to the U of A. The other part of my career is in the pediatric emergency. So I work there, and I'll be seeing some of you guys, I guess, coming through during your clerkship pediatrics rotation. So the goal this morning was just to give you guys a little bit of information on global health, specifically the electives and the opportunities. Some of you are quite familiar with it. I think some of you have gone on some trips, some projects at the end of first year, and I've actually met a few of you in the last few days during our debriefing sessions, and for others this will be kind of new information, and hopefully we'll have lots of time for questions and so on. And as it's been mentioned already, there's several other sessions coming up, including September 13th, I think that Marissa's coordinated, where I'll be there as well to talk about electives. So, many ways to define global health. If we look at one way to look at it is saying that it's some health-related activities to reduce disparities, inequalities in health status and access to services. The multidisciplinary aspect is key, and those of you who've done some global health work are familiar with that. Looks at different aspects, so education, research, and clinical service, so seeing patients as well. And through our field stations and so on that we're developing, some sites have a little more of a component than others, so maybe the education portion, the service, and so on, but we're really trying to look at these three aspects for the different partnerships that we have and so on. Human rights is a key component to global health. And cross-border collaboration, and trying to make a lot of these partnerships and projects that we're developing really as bilateral as possible in different ways. So partnerships between the host and the sending institution. The sending institution doesn't have to be the U of A. Again, this idea of collaboration, so having other institutions in Uganda, for example, having whether it's a resident come or a faculty, potentially a student as well, although in the past, it's been a little bit easier to coordinate for resident or fellow experiences, as well as faculty. Having a collaborative approach to student selection, so when we're looking at the field stations and so on, I think that's one of our goals, both for us and for the collaborating institution as well, is who's going to be the best fit, not individually, but in terms of level, sending first, second year students versus maybe waiting a little bit for certain sites and trying to go later on in the fourth year, for example. So those are the kinds of things we look for. Some sites, when we ask them, what's the best way for us to give back because we're sending you students and so on, sometimes they'll say, look, if you could send, a more senior resident or a faculty at some point, be able to teach on rounds and so on, it's one way to kind of give back. Big part of this as well is preparation, both for students and residents as well. So some of you have gone on electives and done pre-departure preparation and so on that we'll talk about, and that's across the country really in global health discussions and so on. We're looking at this. I think it's done better nowadays than it used to be 10 years ago, but there's still definitely room to improve, and that's where your feedback is very important for us. The kind of thing that comes up is ethics, for example. How can we better prepare students and residents as well in terms of the ethics of working in lower middle income countries and so on, and some of the preparation, the teaching can be done in person. Nowadays there's way more available through modules on the internet and podcasts and so on as well. So this is a work in progress, and we definitely welcome your feedback in terms of that preparation, and also the debriefing after. We really try to make sure that we have a bit of one-on-one time, which is what Dr. Conkin and I have been doing the last couple of weeks with some of you returning and hearing about your elective, hearing what went well, what didn't go so well, and so on. So the safety component is very important as well. Obviously, some places in the world are trickier than others, and that's also a fluid situation. Things change. Sometimes we have no control over it, natural disasters and so on, but those are things we look at when setting up these field stations. The supervision is very important as well. We do our best to try to understand who's going to be the supervisor and so on, and I think programs like the IFMSA do the same, but sometimes it's a little bit out of our control, and certainly heard this week from some of the debriefing that occasionally the surgeon that you were going to be linked to for the month is actually way busier and has another 12 students that they may not have known about and so on. So we try our best to coordinate and to plan, but sometimes things are out of our control. The faculty development portion is important as well, and I think that's one of our goals with the idea of these field stations and so on, is to provide opportunities for learners from U of A and from the other site, but also for faculty in terms of medical education, research, and so on. So just to go through a few of our established collaborations, so the Aga Khan University in Kenya, Fudan in China, I think a few students have gone this year, MUST, or the Mbarara University of Science and Technology. So Uganda is a country where we have a few partnerships actually, and it's exciting, and there's faculty here that are quite involved. So Mbarara is one, the malaria electives through Dr. Hawks from Pediatric Infectious Disease and so on. A few students have gone, and Makerere University, so the capital of Kampala. So Uganda is definitely a strong site for us, and we're excited to be able to to have some of our learners there, as well as residents and faculty, and really bilateral in terms of having some Ugandan learners and faculty come. I think we have a few faculty from Uganda coming in September visiting. Nepal has been a strong partnership for a number of years, so the Padma Academy of Health Sciences. A few of us have taught there. Dr. Conkin's been many times and so on. So that's really an ongoing partnership. I brought a few pediatric residents a few years ago there, and I think the experience has been very strong. Taiwan has been specifically in emergency medicine, I think through Dr. Bullard in emergency medicine. And Trinidad is a fairly new one that Dr. Conkin's been involved with. At the University of the West Indies, so some exciting opportunities there, and we're just continuing to work on that. In the Philippines, there's a few things. So Dr. Conkin's been involved in the first one. This is less likely to be some clinical opportunities, probably more research, faculty development, and so on. Potentially some research opportunities for students eventually. I've been involved at the University of the Philippines and what's called the PGH, which is a huge public hospital in Manila, and there's a lot of keen interest from their side in terms of developing partnerships with us. We've had a few residents go and so on, and we're looking at potentially having a few Philippines residents come here for some extra training, so potentially some opportunities for students as well if there was interest. In Ethiopia, there's been a few things. We've had a very large project for the last number of years with grants and so on. I think that project is coming to an end. But there's this newer opportunity in Hawassa that I'm just learning about, that Dr. Conkin's been involved with. The Ghana partnership is fairly new as well, and sort of in development, but some neat opportunities there, and hopefully for students specifically in Tamale, and then in Peru as well, a newer partnership that we're working on. We're hoping for a Latin American partnership, at least one, and so there's we have some contacts in Brazil, and a few years ago we sent some of our students here to Brazil for an elective, so we're potentially looking at that as well. But Peru, Dr. Conkin's been in meetings and so on, so this one is coming up and developing. Any questions at this point, guys? So in terms of just an overview of global health initiatives and so on, and activities, some of you are familiar with this. So the field station program that I've just gone through, risk management training, 12-hour global health electives. So That's a key one. The Global Health Fair, which I think is in February.
First Monday of February.
First Monday of February for 2020. Global Health Rounds, which are starting this September, so September 23rd, starting for the year again at noon. I know you guys have busy schedules, but anyone available is more than welcome to come. And I think we may at times have some of the students present, I guess, on their elective opportunities, but I know logistics-wise it can be challenging to be there at that time. The Biomedical Research Network, that's through Joel Dax, that's right. So lots going on there. The Rich Men Poor Men Dinner, that's been going on for a number of years, and some of you are involved in that as well. That's usually in March. And the Global Health Weekly, which is a newsletter with some information coming out, and you guys are all more than welcome to sign on the newsletter so you can receive that. Specifically in terms of international electives, so the field station through the Faculty of Medicine, I guess that's probably referred to the European electives more that have some neat opportunities that I think there may be another session to go through that a bit. The IFMSA, again, I think there's a session in the next couple of weeks on the details there. Some students have gone with other groups, for example, Child Family International, Health International, many other groups and so on that you can organize. And then there's other partnerships as well with other different divisions, different departments. For example, in pediatrics, there's been a partnership with Ghana, with the Port Teaching Hospital for a number of years. It's been a little bit quieter the last few years, but when I was a pediatric resident, there's a bit more activity and it's continued. Dr. Moreau from Pediatric Orthopedics is quite involved in Ecuador with his group and so on, and the list goes on. This is just a couple. Sometimes some of those, there may be opportunities for students as well, but I think in the past, quite a few of these have been more resident opportunities as far as I know in terms of those specific partnerships. In terms of the field stations themselves, so clinical versus non-clinical. Many are clinical. The non-clinical ones can be public health oriented, sometimes research oriented in terms of coming up with a project. First come, first serve for the location, so of course we can't send 20 people, but I think Patricia sends dates and so on, so you guys are familiar with, when the dates are coming up in terms of applying. And the bursaries, so varies year to year, and the bursaries from the faculty are specifically for lower middle income countries. In terms of expectations when you return, so I mentioned the Global Health Fair, so we like to have the students present there and have a poster on the project. I think a written report has been done in the past. We're sort of discussing that now, if that would be of value. In some programs we do, like through the Canadian Pediatrics Society, we ask the residents to write a written report when they come back, and that's quite valuable, even in terms of helping future residents going and so on, in terms of what worked and what didn't work so well. So prerequisite for international electives, there's a form, the risk management training, that's through U of A risk management. The vodcasts, I think Dr. Honkin, you worked on some of those, so those are available for you. The 12-hour Global Health elective I've mentioned. Coming up with objectives, so it's really important, before an elective like this to try to come up with reasonable electives. Of course, there's fluidity, and sometimes things change a little bit once you get there, but as much as possible, so you can think about things and plan and do some preparations. And then in terms of meeting with you guys before you go, and certainly the post-departure debriefing is important for us and for you guys, and a chance to chat about the experience. So the new requirement, I think the risk factor has come at least from Alberta Health Services, although that probably is more for the residents.
It's the new accreditation standard, and this is for all going to non-field station sites.
The non-field station sites, in terms of the preparation and so on, and the preceptor well identified. in advance. The faculty of medicine bursary, yeah, that's newer, right? I think for non-field station sites. So there are some potential there. I don't. Did anyone get it this year? That's being followed up, I guess, in terms of the summer.
People will be getting their bursaries in September this year.
Right, from the faculty to bursary. Okay. So what to expect on electives? So the new culture, I think I've heard from a few of the students this week, just the immersion into a new culture, new language, and so on, can be very, very rich, can be challenging at times. Learning about the local health system, sort of the private versus public, and the many challenges that a lot of patients and families and so on have in these lower middle income countries, I think can be a rich experience. And then, yeah, public health opportunities, Dr. Khan, that specifically was for the non-clinical electives. And then, yeah, clinical shadowing and so on in terms of expectations. And the medical knowledge, and I've heard this week during the debriefings again, just very rich experiences in terms of, you know, whether it's hands-on or not, but just even after first year of what people have seen and been able to experience and so on. So that kind of wraps things up. Any questions or anything, Dr. Tonkin, you wanted to add? No, did anyone have any questions or comments? No? If not, thank you very much.